Hi, Dave Reilly on April 1st, 2020. I want to talk about the principles of humanitarian assistance and how these apply specifically to the pandemic situation that we find ourselves in now. So there's a report from 2012 that was assigned in class presented by Oxfam called Crises in a New World Order. And they have a number of lessons and recommendations, and I want to talk about 6 of those in particular that I think are of value in the context of the current situation. The first is the idea that when we look at humanitarian assistance responses, we need to be more proactive in bringing in voices and resources and feedback and opportunities from the non-North, or what also might be called the non-Western approach. If we think about that in the context of the current pandemic, I think the best representation of what the failures of not doing this looks like come from India. And in India, what we're seeing is the reality that social distancing is privilege, right? So in India, in many parts of India, in the slum areas in particular, social distancing is simply implausible for a number of reasons. First of all, because of the pure crowding that takes place, the need for jobs and work and food that bring people together into singular locations. Even when the work itself is being done, the lack of human rights application to these situations. And so there was evidence of a situation where workers were disinfected using a bleach spray the other day that was caught on camera. Think about the fact that the CDC is currently considering whether or not to recommend masks for people. And that's, again, a very clear indication of privilege. Not everyone has those resources available to them. So that issue of bringing in the non-North perspective before we ever get to this kind of a pandemic is important for recognizing what are the limitations in certain parts of the world and how can we rethink what sort of policies and recommendations should be implemented. The second one is building local capacity. And this is through all of the literature that we've looked at in humanitarian assistance, building resilience, making local capacity sufficient. In other words, getting to a point where the local environment is capable of dealing with these issues and has the expertise to be able to bear whatever is needed in the event of an emergency, and that they are capable and effective in their responses. The vulnerability of populations is another, and recognizing exactly what your population looks like in terms of gender, in terms of age, in terms of disability, in terms of a variety of other considerations. The better disaster risk reduction and warning of disasters. So in other words, thinking proactively about the steps that we can take to be able to do preparation and do planning so that we don't end up in a situation where we're ill-equipped to deal with a disaster when it does happen. But when we start to see the beginnings of a disaster also, being prepared to communicate that out and to do a better job of recognizing that and taking the immediate steps to limit the consequences of that disaster. Making transparent decisions. And this is absolutely crucial. Trust in government is going to come from communication. It's going to come from a recognition that government is working for the best interests of the population and knowing exactly what that looks like because there is no ambiguity about the way that they are communicating out. And the last one is maintaining space between the political and the humanitarian operations. This is an area where if you look at what's happening right now in the we need to practice social distancing. What you see is that there's a real attempt to politicize and to capitalize on the political opportunities that exist in the midst of this disaster. And that's extremely problematic for the outcomes, for creating solutions that are really effective for the population at large. One of the critical pieces is that you have to think about the entire community, not specific demographics, not specific constituencies that you're playing to, but the population as a whole. We need to get past the idea of, when we do a stimulus package, that the Democrats on the one hand are going to have a particular set of objectives to accomplish through that, and the Republicans, sorry, I didn't have an elephant, but the Republicans have their own set of constituents that they're playing to, and they try and build these into whatever relief packages they create. That's a recipe for disaster. What that ends up creating is suboptimal outcomes for everyone. You end up with a lesser solution because you're trying to pander to specific constituencies. And with this in mind now, I want to talk a little bit about our local context and what's happening in Erie County and where we go from here. So let's talk about the local context, and then we'll bring it back to the lessons that I just mentioned with regard to the Oxfam Crises in a New World Order study. In Erie County, what we're seeing is an increase in the number of cases. We're now over 500 in New York City. I believe that as of March 31st, they had just tested 18,000 more potential cases and found that of those, more than 9,000 tested positive. What that means is that the tests are being given basically to people who they strongly suggest have the virus, right? Let me put that a different way. The tests are not being given out in a way to identify where the spread is taking place, but instead to simply confirm what is already expected. And so we're not using the tests in a proactive way to go out and identify a broader set of data within the demographics of New York State or the country as a whole. That's problematic from the standpoint of being able to stem the spread. And so what we end up seeing is these curves that talk about the increases in cases, the increases in deaths, the increases in hospitalizations, the increases in a variety of different factors, and they look something like this, right? The bell curve itself is cut off. If you look at the bell curve itself, however, we have two different curves that are worth talking about. The first is without any kind of attempt to socially distance. And that's the much taller curve that you see. And so what you have is a more acute set of consequences to that over a shorter period of time. If we actually use social distancing, what you end up with is a flattened curve. But here's where that becomes really important to think about in the context of what I just presented in terms of important considerations. The curve for Erie County, assuming that we engage in social distancing through to the end of the process, has us still looking at a significant number of cases into November, December. And when I say significant, what I mean is that at least into November, we're going to be looking at cases where we don't have enough ICU beds under normal circumstances to meet that need. So we will be at a deficit in being able to respond to this crisis. Now, why is that important? The reason is that I had talked earlier about the lessons are to build local capacity, right, and to build resilience. We need to take the opportunity right now as we are social distancing to figure out how to be more effective, how to hand off the control and the management of this process to local authorities, because sooner or later, and sooner rather than later, federal authorities and state authorities are going to be focusing on their own issues. We're already seeing that in New York State with Cuomo, right? And it's at some level, it's understandable that New York City is getting the focus. We have to have the local ability to manage this crisis. We also need to take the time right now to target and identify who the vulnerable populations are in our area and to make the necessary steps to protect them. And then we also need to think about how we create a better disaster risk reduction within Erie County. How do we do a better job in Niagara County and Western New York, right? In this area, how do we do a better job of identifying the warning signs and the actual the tactics that we can use to reduce risk? Where we will fail in that regard is if we don't make transparent decisions and if we allow politics to play a critical role in the way that this plays out. So I hope you can see that when we think about the broad international perspective on this and the local context, there is really important overlap, and the lessons that we draw from a course like Principles of Humanitarian Assistance can really be applied very, very directly to what we see in the current pandemic.